Permettez-moi de vous expliquer brièvement le processus. Tout d'abord, avant de prendre un vol de retour vers le Canada, les compagnies aériennes doivent s'assurer que les passagers à bord de leur avion ne présentent pas de symptômes de la COVID-19 et n'ont pas été exposés à une personne qui en est atteinte. Les voyageurs qui entrent au Canada par voie aérienne, terrestre ou maritime, à moins d'être exemptés, doivent également fournir des renseignements par l'entremise d'ArriveCAN ou en composant un numéro
This is Dominic
sans
LeBlanc, the
frais
Minister of
pendant
Intergovernmental
leur
Affairs.
période
He's
de
strongly
quarantaine
discouraging
ou
all
d'isolement.
non-essential travel
Lorsque
outside
vous
of
arriverez
Canada and
à la
giving some
vous serez
rules
soumis à des
around what has
mesures
to
de
happen if you
contrôle
do choose to
et
go
de
outside of Canada,
sécurité
because constitutionally you
extrêmement
cannot be barred from coming
Nous
back
avons
into the
accru la
country.
présence
So he's reiterating the 14-day quarantine rule.
du Canada dans les aéroports internationaux pour nous assurer que les voyageurs comprennent leurs obligations en matière de quarantaine.
Saying that it'll be made clear to passengers coming back that they will have to quarantine, and there will be follow-ups to make sure that they're quarantining.
Et il est efficace. Les rares fois où quelqu'un apporte la COVID-19 au Canada, lorsqu'il est en quarantaine, le virus s'y arrête. Il ne se propage pas dans la communauté. Peu importe le pays d'où vous arrivez ou l'endroit où vous rentrez au Canada, vous devez vous mettre en quarantaine pendant 14 jours,
you have to go into quarantine for 14 days.
Exception explicite.
Except
Votre
for explicit
respect des
exceptions.
exigences énoncées ci haut sera vérifié régulièrement, y compris par des visites en personne.
You'll be checked on regularly by phone and in-person checks.
Votre cas pourrait être renvoyé aux autorités de l'application au besoin. Soyons clairs, si vous ne respectez pas la quarantaine,
If you don't respect the
vous pourrez
quarantine,
faire face à un an maximal de 6 mois et
you could face jail
ou une
term of 6
amende
months
maximale de $750,000.
or a fine of $750,000.
Votre famille, vos amis et votre collectivité à
And you
risque.
would be putting your family and
Certains
friends
Canadiens ont
at
quitté
risk.
le pays pour des raisons non essentielles, malgré les recommandations claires de santé publique de ne pas le faire.
We're asking people to not leave Canada for non-essential
Mais
reasons.
à leur retour, ils ont la responsabilité et l'obligation légale
But if you
de se
do,
mettre en quarantaine
you have legal
pendant
responsibilities
14
to put
jours.
yourself in quarantine
Il
for
suffit
14
de
days.
quelques personnes qui interrompent la quarantaine pour propager le virus à la collectivité et ailleurs. Nous n'avons qu'à examiner le variant de la COVID identifié
It's talking about the variant in the United Kingdom
au Canada
that is now in
pour
Canada.
comprendre pourquoi.
And this is why we have to ensure that the quarantine
Soyez
is done properly,
responsables et surtout soyez raisonnables. Les règles
responsibly
ne nous
and
protègent
reasonably.
que si nous les suivons tous.
This only works if we all follow the rules.
Évolution. À ce titre, je veux également rappeler aux Canadiens que les restrictions changent rapidement et
Remind
peuvent être
Canadians
imposées par des pays avec peu de préavis.
that restrictions change
vous
quickly
choisissez de
and
voyager,
that countries change
vous
their
pourriez
rules
être
quickly with
contraint à rester
very
à
little
l'extérieur
notice.
du Canada
You could be forced to
plus
stay out of
longtemps que
Canada
prévu.
longer
Pour
than
notre
you
part,
had
le
planned.
gouvernement du Canada continuera de prendre toutes les mesures
The government of
appropriées
Canada
à nos frontières.
will
Il y a
continue to
maintenant
impose
plus de
measures at our
180
borders.
agents de santé publique présents au point d'entrée à travers le pays. De plus, les mesures de restriction de voyage et les mesures frontalières que nous avons mis en place depuis mars sont efficaces.
Restrictions
Par
on
exemple, nous
travel.
ne permettrons pas aux gens de rentrer au Canada pour faire des achats,
You can't come to
rendre
Canada
visite à des amis,
to do shopping,
ou
to
pour
visit
des
friends,
visites touristiques.
or for
Le
touristic
nombre de
visits.
voyages a diminué de 90% dans les aéroports par rapport
The
à
number of visits
2019.
has gone down significantly.
Seulement environ 2% de tous les cas de la COVID-19 signalés au Canada proviennent de voyages.
About 2% of COVID has been brought into the country from outside Canada.
De l'application de la loi provinciaux, territoriaux et locaux pour veiller à ce que les voyageurs respectent des règles de quarantaine. Nous évaluons, comme j'ai dit au début, en permanence les mesures actuelles pour nous assurer qu'elles fonctionnent et nous explorons les moyens de mettre en place des niveaux de protection supplémentaires.
He's talking about maybe supplementary measures.
COVID Cabinet Committee meeting this morning and following conversations with the Prime Minister earlier this week and just a few minutes ago, I can announce that Canada will quickly implement the requirement for all arriving passengers to have a negative PCR COVID test 3 days before arriving in Canada. Lors de notre réunion du comité
During today's Cabinet COVID-19 meeting and following conversations with the Prime Minister throughout the week and a few moments ago, I announced that our government will quickly be implementing further measures. Passengers arriving in Canada will have to have a negative COVID-19 test results from a test performed within 3 days of their arrival to Canada. We continue to make decisions based on scientific evidence and data. That is what informs our border measures.
The microphone to my colleague, Bill Blair. Bill?
Thank you very much, Minister LeBlanc. Good afternoon, everyone, and thank you all for joining us here today. As you have already heard from my colleague, Minister LeBlanc, Canada is continuing to take strong action to limit the spread of COVID-19 in our country. And to that end, we have implemented some of the strongest border measures in the world. Today, we want to reinforce a very simple but important message. We strongly advise against travel unless it is absolutely necessary. The federal government, and in fact, no government in Canada, can prevent Canadians from traveling. But I want to be very clear. We strongly advise against all discretionary travel. And if you must travel, understand that upon your return to Canada, you must follow guidelines and quarantine for 14 days. It's not just the right thing to do. It's the law. And if you do not follow the requirements, it can result in significant consequences. Let me walk you through that process. First, before you board a flight home to Canada, the airlines are responsible for making sure that all passengers on board their aircraft are not exhibiting symptoms, nor have been exposed to anyone with COVID-19. Travelers who enter Canada by air, land, or marine modes, unless exempted, will also be required to submit information through ArriveCan or by calling the toll-free number during the quarantine or isolation period. When you arrive at the border, you'll be subject to strict screening and security measures. We have significantly increased the presence of CBSA officers at our international airports to ensure that travelers understand their quarantine obligations and to verify their traveler's quarantine plan. Our quarantine requirement is our strongest and most effective measure. It is among the strongest in the world. On the rare occasion that someone brings COVID-19 into Canada, when they are in quarantine, the virus stops there. It does not spread further into the community. And so no matter where you are coming from or where you enter Canada, you will be required to quarantine for 14 days. Your compliance with these requirements will be verified regularly. And if needed, your case can be referred to law enforcement in cases of non-compliance. And let me be very clear. If you violate quarantine, you can face up to 6 months in jail or up to $750,000 in fines. But far more importantly, you will put your family, your friends, and your community at risk. Now, we know that some Canadians have traveled out of the country for non-essential purposes, despite the clear public health guidance asking them not to do so. These Canadians, of course, have a right to return home, but when they come back, they have a responsibility, both legal and moral, to quarantine for 14 days. Unfortunately, it only takes a few people who break quarantine to spread the virus to the community and beyond. We only need to look at the COVID variant recently identified in the United Kingdom, which is now in Canada, to understand why. And that is why we are urging all Canadians to please be responsible, be sensible, and care about your fellow citizens. The rules only protect us if we all follow them. This is an ever-evolving pandemic. I'd like to remind Canadians that restrictions are changing quickly, and they may be imposed by Canada or other countries with little warning as circumstances require. And if you choose to travel, you may be forced to remain outside of Canada longer than you anticipated. For our part, the Government of Canada will take every appropriate measure that we can to protect our citizens at the border. There are now, for example, more than 180 public health officers present at points of entry across Canada. And the travel restrictions and border measures that we have put in place since March have been working. And for example, we do not allow people into Canada for non-essential purposes. We don't allow cross-border shopping, visiting with friends, sightseeing, or holidaying in our country. And as a consequence, travel volumes are down by over 90% at our airports compared to 2019. And through very careful contact tracing, we've determined that approximately 2% of all known COVID cases in Canada have originated from travel outside the country. 2% is very low, but it's still unacceptable. And that's why we must and will continue to work together with our provincial, territorial, and local law enforcement partners to ensure that travelers are following the quarantine rules. As I've already said, Canada has one of the strongest regimes anywhere in the world, but we are prepared and resolved to continue to add additional layers of protection to make it stronger. We will always continue to evaluate our current measures to make sure they're working, and we are exploring ways to build additional layers of protection. And I am therefore pleased to advise that CBSA is increasing its presence at our airports. Additional border service officers will be present at various positions in the traveler flow to reinforce compliance messaging. Beginning yesterday evening, additional teams of enhanced visibility officers were also deployed throughout the customs halls and baggage area and around the primary inspection lines to engage with travelers and to increase officer presence through conversation, highlighting the traveler's obligations and potential enforcement action that may be taken if the traveler is non-compliant with the all-important quarantine requirements. We've also, those officers are also helping to potentially identify any additional travelers who may have signs or symptoms of COVID-19. We are investing in additional uniformed police presence, signage, follow-up calls, and support for police of jurisdiction in their enforcement efforts to uphold and maintain compliance with our quarantine measures. As you have already heard, discussions are underway to further increase enforcement on current measures about greater testing before travel and upon arrival. As Minister LeBlanc advised, the Minister of Transport will be adding a requirement for pre-COVID testing on all flights before entering Canada to further strengthen the robust measures we have already have in place at the border to our 14-day quarantine. I also wish to be very clear. This is not an alternative to quarantine. It's an additional layer of protection. And the measures that are contemplated by the Minister of Transport to require pre-boarding testing and verification of that testing are in addition to the quarantine measures. And so once in place, those measures will enhance our efforts to keep people safe and not offer an alternative to the all-important quarantine period. I'm advised that Minister Garneau, our Minister of Transport, will be engaging with the airline industry on this new requirement, and additional details will be made available by him shortly on how this requirement will be implemented. In addition, discussions are also underway regarding a testing pilot program at the Toronto Pearson International Airport. This pilot explores how a testing and monitoring program can be used to provide an additional layer of defense against the spread of COVID-19. This follows a testing pilot underway in Alberta. We look forward to sharing more details as these pilots are completed. And as well, work is well underway between the provinces, CBSA and our public health officials about testing at additional locations. In our discussions with the province, we have heard some desire to use an entry testing regime to reduce the length of mandatory quarantine for travelers. I believe at the current time, we should only be considering testing as an additional measure of a layer of defense against the illness coming into the country. We will continue to strengthen compliance with this very effective tool of quarantine. And we will always continue to use science and evidence to inform any next steps. And we rely on our excellent officials at the Public Health Agency of Canada for that advice. I look forward to continuing the work with all of our partners and making sure the measures we take at our borders are in accordance with the latest public health advice. And to be clear, we have one of the strongest regimes for the protection of Canadians at our borders of any country in the world. It has proven to be effective. We are asking people to follow the rules, but unfortunately, there will always be some people who choose to ignore them. Some people are going to choose to travel against our advice, and Canadians, I know, are concerned about those who are choosing to enter into non-discretionary travel, discretionary travel. And that's why we believe it is necessary to enhance the measures that we have currently in place to ensure that Canadians returning from that travel are safe to do so. We know that we have a vaccine beginning to roll out across the country, but I want to be very clear. We still have a long path to go. We have a great deal of work to do, and I want to ensure and urge all Canadians continue to follow the advice of our public health officials. Avoid non-essential travel. Continue to use the health and safety measures of hand washing, mask wearing, and social distancing that have proven to be the effective measures. And for all of those who choose to travel and cross our borders, understand the importance of quarantine and that we will take the steps necessary to ensure their compliance. Thank you very much. And I'll now turn the microphone over to my friend and colleague, Mr. Haidu.
Well, thank you very much, Bill and my colleagues. I do have to say that it's very concerning to continue to see people across the country become infected with COVID-19. And as the number of people sick with this virus rises, so does the hospitalizations and the deaths all across our communities. And the suffering that many families are facing is significant and heartbreaking. Dr. New is going to provide an update shortly. But it is a sign that all Canadians have to work even harder to protect each other as we enter this increasingly dangerous time. As more people become infected, more people are also hospitalized, creating exhausting situations for healthcare workers across all settings who are working so hard to ensure quality care and save lives. The outbreaks in long-term care continue to devastate families and communities. Heartbreaking deaths over the last days in the Southbridge Roseview residence in Thunder Bay and in the Tender Care residence in Scarborough, just to name two, are tragic, especially given what we know now about how to protect residents of these care facilities. Our federal rapid response program will continue to work in partnership with provinces and territories to help in these and other outbreak settings. Over the past several days, we continue, as my colleagues have pointed out, to see Canadians choosing to ignore the federal travel advisories that warn against international travel. And our message is clear. Now is not the time to travel internationally. Any person that does choose to travel internationally is subject to a mandatory 14-day quarantine that will be enforced. The number of public health officials at the border and making phone calls to follow up with returning travelers has increased since last March. And for Canadians who are choosing to ignore the federal travel advisories, we will be increasing quarantine verifications. In the days to come, we'll be adding a requirement for pre-boarding COVID testing for passengers on all flights entering Canada. And this new measure will further strengthen our robust efforts to prevent imported cases of COVID-19, but also allow us to further Canadian research on the most effective measures and combinations of quarantining and testing. And we'll continue to work with Quebec and Ontario on testing studies at the border. Everything that we will do at the border will be based on science to protect Canadians. We share the frustrations of Canadians who have been making sacrifices for months now when they see images of a minority of Canadians, their friends and their family and community members who are not following the rules. It is unfair to the millions of Canadians who put their lives on hold to protect each other. Our border measures, including the 14-day mandatory quarantine, are some of the strongest in the world. In fact, as my colleagues have pointed out, they've prevented the importation and spread of COVID-19 so that provinces can remain focused on reducing community spread, protecting seniors, building their testing and tracing capacity, and most recently, vaccinating Canadians as quickly as possible. And we've been there for provinces and territories since the beginning. We've provided billions of dollars in safe restart funding to enhance testing, contact tracing, data management, and protection for long-term care. We've procured millions of PPE for healthcare workers all across the provinces and territories. We've provided millions of rapid tests for deployment in high-risk settings. We've sent in experts and the Red Cross and supported the clearing of backlogs of tests through our rapid response program. We funded quarantine centers to better isolate people with no safe place to stay. We've helped to house homeless and other vulnerable populations to protect them from infection in crowded spaces. We've provided thousands of contact tracers to help reduce outbreaks, and we've ordered, paid for, and delivered approved vaccines way ahead of schedule to save lives and to stop the spread. All of this has been done to protect Canadians and their close ones. Our government will continue to be there for Canadians, but we cannot do the work alone. Canadians expect us to work together, and we need everyone to help. We need to pull together for the next bit of time to reduce the spread and save lives. We know the next few months are going to be hard, but we each have it in our power to help. Stay home, cancel your non-essential travels, and help out wherever you can. The simple actions that we do for each other today will protect someone's grandmother, someone's father, someone's sister. Let's continue to protect each other, Canada. And as we begin to see that light, let's make sure that we all get to safety together. Thank you.
Good. Thanks very much, Patty. And Dr. New, over to you.
Okay. Bonjour à toutes et à tous. I hope that you've all had a healthy, safe, and happy holiday long weekend. There have been 565,506 cases of COVID-19 reported in Canada, including 15,378 deaths. Nationally, there are over 72,271 active cases across the country, with over 6,280 cases being reported daily on average over the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average almost 3,650 individuals with COVID-19 being treated in Canadian hospitals, including over 720 in critical care, and an average of over 136 deaths were reported each day. This week, we have seen a Moderna vaccine arrive in Canada's north for distribution to remote and Indigenous communities, and it is arriving in provinces as well in the coming days. Tens of thousands of people in our country have already been vaccinated with the Pfizer vaccine, and vaccines continue to be distributed. By September of next year, we are on track to be able to offer vaccination to everyone in Canada for whom vaccines are approved and recommended. As most Canadians are aware, several cases of the new COVID-19 variant identified in the United Kingdom have now been reported in Ontario, Alberta, British Columbia, and Quebec. All people identified in Canada with the variant were fortunately already in quarantine. Quarantine has proven to be a protective health measure that works. A monitoring program is currently in place with provinces, territories, and international partners to identify other COVID-19 variants as well, such as the one in South Africa. As the monitoring continues, it is expected other variants of concern will likely be found in Canada. To protect Canadians, the Government of Canada suspended all commercial and private passenger flights from the UK into Canada on December 20th and will continue to do so until January 6, 2021. All travelers entering Canada are subject to COVID-19 entry screening, regardless of their country of origin or mode of entry. In addition, all travelers who have recently been in the UK or South Africa are now also subject to secondary screening and enhanced public health measures, including increased scrutiny of quarantine plans and rigorous monitoring to ensure travelers are complying with quarantine measures. While early data suggests that the United Kingdom and South African variants may be more transmissible, to date there is no evidence that there is any impact on disease severity, antibody response, or vaccine effectiveness. Although most Canadians have heeded advice for non-essential travel, some Canadians are still traveling for non-essential reasons. This is deeply concerning. We must iterate that now is not the time to travel. We are asking Canadians to reassess any travel plans. Stay home to protect yourself, your family, and those most at risk of severe illness from COVID-19 in our communities. If you need to travel, you must now use the ArriveCan app before your arrival to Canada and for mandatory reporting during quarantine. You can learn more about this app at canada.ca/coronavirus. Mandatory quarantine is just one of the layers that our public health system is using to prevent the introduction and spread of COVID-19 in Canada. We've implemented some of the strongest border measures in the world, and we will continue to work together with our provincial and territorial partners to ensure that travelers are appropriately adhering to the mandatory quarantine upon entry to Canada. We will continue to evaluate the measures that are in place and evaluate new measures as the situation warrants. Looking forward to 2021, there's a lot to be hopeful about. Safe and effective vaccines are beginning to be administered. However, we must remember that until vaccines are more widely available to all Canadians, we must continue to follow our proven public health measures to control COVID-19. Canada remains on a trajectory for resurgence over the next 2 months. With infections rates remaining very high in many areas of the country, we must ring in the new year differently this year and resolve to carry on with effective public health practices throughout the coming months. Follow public health advice, plan safe for holidays, stay home if you have any symptoms, and practice physical distancing, frequent hand washing, and wearing a mask as appropriate. Merci, thank you. Bonjour à toutes et à tous. J'espère que vous avez passé une longue fin de semaine.
I hope you all had a healthy, safe, and happy holiday long weekend. There have been 565,506 cases of COVID-19 reported in Canada, including 15,378 deaths. Nationally, there are over 72,271 active cases across the country, with over 6,280 cases being reported daily on average over the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were, on average, almost 3,650 individuals with COVID-19 being treated in Canadian hospitals, including over 720 in critical care, and an average of over 136 deaths reported each day. This week, we have seen the Moderna vaccine arrive in Canada's north for distribution to remote and Indigenous communities. It is arriving in provinces as well in the coming days. Tens of thousands of people in our country have already had a shot of the Pfizer vaccine, and vaccines continue to be distributed. By September of next year, we are on track to be able to offer vaccination to everyone in Canada for whom vaccines are approved and recommended. As many Canadians are aware, several cases of the new COVID-19 variant identified in the United Kingdom have now been reported in Ontario, British Columbia, Alberta, and Quebec. All people identified in Canada with the variant were fortunately already in quarantine. Quarantine has proven to be a protective health measure that works. A monitoring program is currently in place with provinces, territories, and international partners to identify other COVID-19 variants as well, such as the one in South Africa. As the monitoring continues, it is expected that other variants of concern will likely be found in Canada. To protect Canadians, the Government of Canada suspended all commercial and private passenger flights from the United Kingdom into Canada on December 20th. This suspension of flights from the UK will continue through January 6th, 2021. All travelers entering Canada are subject to COVID-19 entry screening, regardless of their country of origin or mode of entry. In addition, All travelers who have recently been in the United Kingdom or South Africa are now also subject to secondary screening and enhanced public health measures. This includes increased scrutiny of quarantine plans and rigorous monitoring to ensure travelers are complying with quarantine measures. While early data suggests that the United Kingdom and South African variants may be more transmissible, to date, there is no evidence that there is any impact on disease severity, antibody response, or vaccine effectiveness. Although most Canadians have heeded advice for non-essential travel, some Canadians are still traveling for non-essential reasons. This is deeply concerning. We must reiterate that now is not the time to travel. We are asking Canadians to reassess their travel plans. Stay home to protect yourself, your family, and to protect those most at risk of severe illness in our communities. If you need to travel, you must now use the ArriveCan app before your arrival to Canada and for mandatory reporting during quarantine. You can learn more about the ArriveCan app at the website canada.ca/coronavirus. Mandatory quarantine is just one of the layers that our public health system is using to prevent the introduction and spread of COVID-19 in Canada. We've implemented some of the strongest border measures in the world. We will continue to work together with our provincial and territorial partners to ensure that travelers are appropriately adhering to the mandatory quarantine requirements upon entry to Canada. We will continue to evaluate the measures that are in place, and we will evaluate new measures as the situation warrants. Looking forward to 2021, there is a lot to be hopeful about. Safe and effective vaccines are beginning to be administered. However, we must remember that until vaccines are more widely available to all Canadians, we must continue to follow our proven public health measures to control COVID-19. Canada remains on a trajectory for an even stronger resurgence over the next few months. With infection rates remaining very high in many areas of the country, we must ring in the new year differently this year and resolve to carry on with effective public health practices throughout the coming months. Follow public health advice, plan safer holidays, stay home if you have any symptoms, practice physical distancing, frequent hand washing, and wearing a face mask as appropriate. Thank you.
Merci beaucoup, Dr. New.
Thank you, Dr. New. And now, Major General Fortin. Thank you very much. Hello, everyone.
About vaccine distribution to date. The deliveries of the December allocations of vaccines, both Pfizer, BioNTech, and Moderna, are nearing completion, and we're poised for a sustained tempo in January and accelerate that tempo through early 2021. On the heels of last week's Health Canada Regulatory Authority announcement, we received 168,000 doses of Moderna vaccine. They are being delivered this week. Shipments to Canada's north began on Monday, and by tomorrow, we expect the remaining shipments of our December Moderna allocation to be delivered to designated vaccine delivery sites, including several northern, remote, and isolated communities. We're now in our third round of shipments from Pfizer-BioNTech. Last week, 212,000 doses were delivered to over 70 sites, and more than 12,000 will be delivered this week. This will bring the total to 424,150 vaccine doses delivered in Canada this month. Looking forward into January, we expect weekly shipments of Pfizer-BioNTech vaccines in the amounts of 124,000 for the week of January 4th and 208,000 per week for the following 3 weeks. For Moderna January's allocation, we're expecting a further 170,000 doses the week of January 11th. We're on track to have at least 1.2 million doses of Pfizer-BioNTech and Moderna delivered by end of January. So to adequately manage the unique cold chain requirements, we continue to acquire and deliver enabling equipment and supplies with deliveries planned in the upcoming weeks. This will enhance cold chain capacity and flexibility across the country and facilitate onward distribution to smaller locations. Online training for the workforce continues, and provinces and territories are identifying and preparing their teams to administer the vaccines. In collaboration with our federal, provincial, territorial, and Indigenous partners, we're building capacity to enhance the delivery of vaccines across the Canadian landscape and to ensure that as many Canadians as possible get immunized against COVID-19 and as quickly as possible. Permettez-moi de faire le point maintenant sur la distribution des vaccins contre la COVID-19.
I would now like to give an update on vaccine distribution. It is proceeding according to plan. Deliveries of the December allocations of COVID-19 vaccines, both Pfizer-BioNTech and Moderna, are nearing completion. We are poised for a sustained tempo in January and an accelerated tempo into February and March of 2021. On the heels of last week's Health Canada Regulatory Authority announcement, we received 168,700 doses of Moderna vaccine. They are being delivered this week. Shipments to Canada's north began on Monday, and by tomorrow, Thursday, we expect the remaining shipments of our December Moderna allocation to be delivered to designated vaccine delivery sites, many of which are located in northern, remote, and isolated communities. We are now in our third round of shipments from Pfizer-BioNTech. Last week, 212,000 doses were delivered to over 70 vaccine distribution sites. Over 12,000 will be distributed this week. This will bring the total to 424,000 vaccine doses delivered in Canada by the end of December. Looking forward to January, we expect weekly shipments of Pfizer-BioNTech vaccines in the amount of 124,800 for the week of January 4th and 208,000 per week for the following 3 weeks. As for Moderna's January allocation, we are expecting a further 170,000 doses the week of January 11th. We are thus on track to have at least 1.2 million doses of Pfizer-BioNTech and Moderna delivered by the end of January. In order to adequately manage the unique cold chain requirements, we continue to acquire and deliver enabling equipment and supplies, with deliveries planned in the upcoming weeks. This will enhance cold chain capacity in provinces and territories, as well as enhancing flexibility across the country and facilitating onward distribution to smaller locations. Online training continues. Provinces and territories are identifying and preparing their teams to administer the vaccines. In collaboration with our federal, provincial, territorial, and Indigenous partners, we are building capacity to enhance the delivery of vaccines across the Canadian landscape and to ensure that as many Canadians as possible can be immunized against COVID-19 safely, effectively, and as quickly as possible. Also, I wish to extend my best wishes for the new year for 2021 to all Canadians. Thank you. Thank you, Major General. And now we will take questions.
Thank you. We'll now take questions from media. One question and one follow-up, please. We'll start with 2 questions on the phone. Operator.
Thank you. La première question est de Boris.
First question, Boris Proulx, Le Devoir. Question. Hello. My question is for all of you, but maybe for Minister Blair or Dr. New. When will negative COVID tests become a requirement for entry to Canada? Also, when will there be rapid tests in Quebec's airports. Quebec has requested these actions be taken as soon as possible. Answer. Minister Leblanc. I will answer first, and then perhaps my colleagues can add to my answer. Today, we're announcing that a negative test result requirement will be announced in the next few days. Minister Garneau will implement this as soon as possible. But if I'm on a beach in the Caribbean this week, and then I have to scramble to find somewhere to get a test before I return, we have to look into that. Canadians want there to be very stringent, strong border measures for those arriving at our borders. We are working in partnership with Quebec to discuss and work on testing in airports. We are working together very amicably with the government of Quebec. We expect to have more information in the coming days. In the meantime, as Minister Blair has stated, travelers who arrive at Montreal's Trudeau Airport this week and in the upcoming weeks will face additional stronger screening. Quarantine is the most effective way to protect against COVID-19 and limit spread in our communities. Those who arrive to Canada will have more compliance verification. We will be doing more monitoring of quarantine. For instance, visits to the residences of those who are quarantining or increased phone calls. As of now, we are working on implementing a requirement for a negative COVID test results for those arriving to Canada. There will be more information tomorrow. Follow-up. My question is about vaccines, about the Pfizer vaccine. 2 doses, as you know, are necessary. Is Pfizer requiring that provinces store half of the doses for those who have already received a first dose? More specifically, a question for Major General Fortin. Should provinces be worried about future incoming shipments of the Pfizer vaccine? Should provinces start storing second doses for those who have already been vaccinated? Dominique Leblanc speaking. Dr. New, go ahead, and then we'll hear from Major General Fortin. Dr. New, thank you for the question. Yes, 2 doses of the Pfizer-BioNTech vaccine are necessary. 2 doses per person. As I've already said, delivery and shipment of vaccines is very important, and we're working on it. Yes, Pfizer-BioNTech requires that we keep a second dose for those who will have received a first dose of the vaccine. We continue to discuss this with provinces and territories. Shipments are very secure now, very reliable, so I don't think this is something to be concerned about. Provinces are vaccinating as many people as possible with the first dose of Pfizer vaccines, waiting for the second dose. Answer, Major General Fortin. I'd like to add that we are now much more confident about receiving vaccine shipments from Pfizer-BioNTech in January. The company does recommend that we keep a second dose for those who've received a first dose. Now, provinces and territories do have jurisdiction over who they vaccinate. Federally, we will continue to ensure continued flow of vaccines into the country. We are expecting many shipments in January.
Thank you. The next question is from Dylan Robertson from Winnipeg Free Press. Please go ahead.
Hi there. I have to admit I'm getting deja vu here from the spring. Your government is announcing things at a press conference with no start date, almost no detail. There is no tech briefing yet. It's not an efficient way to get information to the public, and it's going to cause a lot of confusion at the airports. My question is, what is the holdup here? You waited until after the Christmas holiday to put in this PCR requirement. The UK flight ban started 9 days ago, and other countries have had this sort of thing for months now. So what took so long?
Yeah, if I may respond, first of all, on when the UK variant was first identified, Canada was among the very few countries in the world that took the strongest measure in response, banning all flights from the United Kingdom, initially for a period of 3 days and then extended through to January the 6th. We know and we've witnessed that other countries have adopted other less stringent measures, including pre-boarding testing. We have been working with our provincial and territorial partners, with public health officials, and with our border officials for several weeks on additional measures, additional layers of protection that we can put in place. And we have, right from the outset, been urging Canadians to avoid all non-essential travel. We'll continue to work with our partners and based on the advice that we receive from our health officials on measures that can continue to strengthen our response to the border. And I would point out as well that, I think we've been very clear about the need for people to quarantine. The evidence is very strong that has proven to be our most effective line of defense for keeping the illness out of Canada. Unfortunately, some people do not obey those rules, and so we are prepared to bring in additional measures to ensure compliance and through pre-board testing. And as we've said, that information will be made available in very shortly by the Minister of Transport, who is currently engaging with the airlines and with officials within his department to bring those measures forward as quickly as possible. But to be very clear, those measures are in addition to the very strong regime of protection at our borders that we have in place, and we'll continue to work to enhance those measures to keep Canadians safe.
Follow-up?
With respect, in the coming days is not a precise answer for when we're getting more information or when this starts. I have a separate question for Minister Hajdu. Is it appropriate that some provinces stopped all vaccinations over the holidays? And is that going to do anything to prevent a similar halt from happening in the future? Or is the federal cabinet totally okay with that approach?
Okay, well, thanks, Dylan. And I do want to just add something to the previous answer from my colleague, Minister Blair. I'll just say that as we look at the measures that are protecting Canadians from importation of COVID-19, the minister is exactly correct. We have some of the strictest measures in the world. The 14-day quarantine, in fact, has allowed us to really capture cases of COVID-19 without allowing further onward spread into communities. But there is a value in understanding the role of testing, both from a pre-departure perspective and also from an arrival perspective. And that's the nature behind the measures that we're talking about today, to enhance the ability for us as a country to add to the body of research. Because, of course, all countries are trying to protect their citizens from importation and trying to understand what blend between quarantine and testing is the safest, but also allows for the essential travel and eventually the resumption of travel. And so I think the work that we'll do on these additional testing pilots, including the pre-departure testing, will build on that national and international body of evidence that will help us determine how best to continue to do this, especially as we know the landscape shifts so quickly. In terms of vaccination, I will turn to General Fortin in a minute to talk about his work with provinces and territories, but I think it's Canadians that expect that we get on with vaccination as quickly as possible. And of course, we know that vaccination saves lives. Every day that we delay, in fact, is another risk for a person in a long-term care home, or a person who works in a long-term care home facility, or other people that are connected to those folks. And so it's really important that as we deliver federally on our commitment for early doses in great volumes, I would say, that originally we weren't sure was going to be possible, that provinces and territories continue their hard work to get vaccinations in arms so that we can all save lives and stop the spread. So I'll turn to General Fortin to answer a few more questions about the logistics at the provincial level.
Well, thank you, Minister. I've said this before, but the Public Health Agency of Canada is working very hard to deliver vaccines. And the Vaccine National Operations Center at the agency is coordinating closely with provinces and territories, ensuring that we have visibility and closely coordinate the entirety of the process from ordering to shipping to delivery to vaccine distribution or delivery sites across the country that are ready. And we work, of course, closely with our different partners to ensure that that's ready. The quantities are small initially, and we've been receiving and administering in provincial jurisdictions to date vaccines that have unique storage requirements, ultra low temperature storage requirements, and preparations that require a level of sophistication that's unseen before. So we closely coordinate with them. I think the next bound will be to ensure that we share best practices between provinces and territories and ensure that we have a ready workforce to administer at scale across the country, and particularly focused on ensuring that we have all the right things in place to administer in some of the most remote and isolated communities throughout the country. And I'm proud to see how well coordinated this effort has been to date with various stakeholders, including the Indigenous Services Canada, as well as the Red Cross and various other entities. So we're progressing very well on this front. I would also add or further emphasize: start small, deliberate, and then we grow as numbers show up. As we get more experience, we grow to we scale up across the country, and we're very much on track to do that.
Thank you. We'll go to the room now. Oh, sorry.
I'm sorry, but I wanted to sort of point out in response to a point that Dylan made. Even 4 days ago, he wrote an article in the Winnipeg Free Press in which he indicated that the airports and the provinces wanted to add rapid tests in order to cut the isolation time. And quite frankly, we would only move forward on a measure like that if the evidence and the data and the advice of our health officials supported it. But what we are talking about today is a very different thing, and that's adding pre-boarding testing as an additional layer of protection. And so, I think it's important not to conflate, the two issues. One suggestion that testing could be used to shorten the quarantine period. I don't think the evidence is there yet that we've made that determination. But what we do believe is that there is a potential for testing to supplement and add to the very effective measures of quarantine. Thanks.
Thank you. We'll come to the room now for 3 questions.
Hi, Rachel Haynes here from CTV National News. My first question is actually about vaccines and the Moderna vaccine. You were just mentioning about the Pfizer, that now that there's more secure access to the second dose, provinces may not have to worry about having to give out just the 1 dose. But yesterday, General Rick Hillier in Ontario was asking Health Canada to review the Moderna vaccine and to approve it as a 1-shot only and never do the second dose. Is that something that Health Canada would consider?
Thanks for the question. It's Minister Hajdu. I will just say that is not what the pharmaceutical company has indicated as appropriate use, nor is it what the regulators have approved based on the pharmaceutical requirements. And I'll turn to Dr. New if he wants to speak a bit more about that.
Yes, thank you very much. I think it's pretty straightforward. Certainly from all of the clinical data from the clinical trials that was submitted by the company to our regulators at Health Canada. From a scientific public health, medical perspective, it's all with the 2-dose regime, and that's what Health Canada has approved, and that's the indication that it should be obviously fall in terms of a 2-dose regime. I think from a scientific point of view, certainly the data in terms of the efficacy of, over 90% is also looking at the sort of the duration of immunity. And certainly there's no data there to look at in terms of if there was a one-dose regime, what that would have in terms of an impact on either the duration of immunity or the efficacy over the long term. So I think really the data's there, the approval's there by Health Canada, and we are continuing to work with the two-dose regime.
So is that something that Health Canada would consider at all, or that's a hard no on looking back at it?
The current indications for a two-dose regime, the company has not submitted any data to look at any alternative regime, so that's what we're working with.
And just as my next follow-up about the AstraZeneca vaccine, I know Health Canada said today that there's not any definite timeline on that, but can you just give a little bit more information now that the UK has approved that vaccine? What more information is Canada still waiting on from the manufacturer, and have they given any update on when we can expect that?
It's Dr. New again. Certainly for the AstraZeneca vaccine, our colleagues at Health Canada are still awaiting more data from the company. So I can't speak to what's happened in the UK, but certainly in Canada with our very stringent regulatory regime, there's additional data that's required that has not been received or maybe is in the process of being sent to Health Canada. Well, what is that? I'm not the regulator, so I don't know exactly the specifics of the data that they're still looking for.
And I'll just add to that, thanks for the question. I have spoken with Deputy Lucas at Health Canada, and that's exactly right. Dr. New is exactly right. There are a number of packets of data that still need to arrive, and as soon as we get the data, we'll be reviewing with the same process that we reviewed Moderna and Pfizer with a rolling regulatory review so that we can assess that data as quickly as it comes in.
Thank you. Next question, David.
Hi, David Thurton, CBC News. So you keep saying that Canada has some of the strongest measures, Minister Blair, when it comes to quarantining international travelers, preventing COVID-19 from coming into the country. So, but it still isn't clear to me what's changed. What has changed in the landscape that is prompting you to implement these additional measures?
Yeah, thank you very much for the question. And when we say we have some of the strongest measures of any country in the world, I just remind Canadians that back in March, we through the Aeronautics Act, and Minister Garneau implemented restrictions on all non-essential travel on international flights. And of course, Canadians still have a right of return, but as a consequence of the measures we put in place restricting non-essential travel on international flights, we've seen a very, very significant, over 90%, decrease in traveler volumes, which I think has been very helpful. In addition, we implemented a mandatory quarantine period for all non-essential travel into our country, including at the land border with the United States. And I remind people that we close that border, again, very effectively to non-essential travel and require everyone who does enter, all those Canadians who are returning from vacations or trips down south, require them to enter into 14-day quarantine. What we are concerned with is at this time of the year, we are strongly advising Canadians to avoid non-essential travel, to not go south on holidays or to visit their winter residences in Florida or Arizona. But we know, first of all, we don't have the authority to order them not to go, but we've issued the very strongest possible advice, encouraging people to be more responsible and to make a safer decision to avoid non-essential travel. But we know some people are traveling. And certainly at this time of the year, we see an increase in people who seek to vacation out of the country and travel for non-essential purposes. And so we want to ensure that they clearly understand their responsibility to enter into a very robust and rigorous 14-day quarantine period, which will protect them, their families, their friends, and their community, and is essential. We want them to understand that, because unfortunately, I think the vast majority of Canadians obey the rules and understand the importance of if they are going to travel for non-essential purposes, to enter into a very full and comprehensive quarantine period. But unfortunately, we have seen some evidence that not everyone is prepared to follow those rules. And we have a responsibility to all Canadians to ensure that the most effective measure that we have in quarantine is actually made as effective as it possibly can by ensuring compliance. And we are prepared, because there is a higher volume of people who are likely to travel for non-essential purposes at this time of the year. We are taking additional steps to make sure that there is a stronger and more visible presence in our customs halls for returning people coming, particularly Canadians coming into the country for non-essential, after non-essential travel, to ensure that they understand their legal obligations. We are prepared to invest in additional follow-up and with phone calls and home visits and door knocks and enforcement if necessary in order to ensure that compliance. And we are also prepared to continue to examine additional measures, layers of protection, if you will, that we can add to our quite effective measures of quarantine, but it's not a perfect defense. And so we're quite prepared to add additional layers of defense and protection to protect our borders. And as you've heard earlier today, one of those measures that we are prepared to move forward on is implementing a requirement for pre-boarding testing and proof of a negative test before people can board planes to come back to Canada for any purpose. We believe that will assist us in potentially identifying some individuals who may be at risk. And I hope people will understand that it's in addition to the quarantine requirement, not a replacement for that. So there has been some discussion of using testing as a means to shorten quarantine. We don't yet have the evidence to support that decision, but we do believe that there is some efficacy in pre-boarding testing to add to the very strict regime of quarantine that we have in place.
Peut-être vous me permettrez juste de répéter en français.
I would like to repeat the answer in French. Minister Leblanc speaking. Currently, under Canadian law, we cannot forbid Canadians from leaving the country or from returning to the country. However, the Federal Quarantine Act requires travelers to Canada arriving from abroad to be subject to a strict 14-day quarantine. We have implemented further measures in order to ensure a more visible presence of law enforcement at our border entry points. For example, Canada Border Services Agency officers. We will also increase home visits to those who are in quarantine to ensure that they are complying with quarantine requirements. Moreover, as we've announced, in the upcoming days, there will be an announcement regarding the requirement to show proof of a negative COVID-19 test results from a test performed within 72 hours of arrival to Canada. As for testing in Canadian airports and the other measures we are describing, these measures will not replace mandatory 14-day quarantine. Rather, they will be complementary, additional measures. As I said, if I were on a beach right now in Florida or in the Caribbean, well, I would be trying to find a clinic or a place to get a COVID test before returning to Canada.
Comments from a public health perspective. Certainly, the quarantine period, the 14 days following arrival to Canada, is the most effective measure we know in terms of obviously limiting the spread of COVID-19. If someone comes in with COVID-19, what we've seen is that the UK variant also shows us that it's another risk, and that's why we're strongly urging Canadians not to travel abroad. Because not only are you at risk of potentially picking up COVID-19, but you could be picking up some new emerging variant and bringing it back to Canada. And we've seen that to be the case with the variant that's been identified in the United Kingdom. You can see that the quarantine has worked because the individuals that have been reported to us, they were all in quarantine, And the cases have not spread beyond, quote, I would call it the quarantine household, either the traveler themselves or maybe their immediate household contacts. So there has not been wider community spread. The other point about testing is that, yes, it's another supplementary measure. It can add to our layers of protection, but in and of itself, it's not foolproof. And I think that the best example is even the cases we've identified so far. The cases that have been reported from the provinces and territories, those individuals, I'd say at least some of them, obviously to protect confidentiality, were asymptomatic or didn't have symptoms upon arrival in Canada and only developed their symptoms after several days post-arrival, being in a proper quarantine. If there was a pre-test done, pre-departure test done, or even at the border, it's likely that those tests would have proven to be negative. So even testing pre-departure or at the border will pick up some people, but not all. And therefore, quarantine, I think we're highlighting or underlining the point, is the most effective measure. Thank you.
Follow-up?
Yes. There's one person, of course, a high-profile person who isn't following the recommendations, the advisories and the urgings that you guys have been saying to not travel. Of course, that's Ontario's finance minister. So I'm just wondering, and maybe the ministers can tackle this, or Dr. New if you want to weigh in, how important is it for our political leaders to model the recommendations and the advisories that you're asking Canadians to follow?
Well, if I may respond, I think it's important for all Canadians to understand why we offer the very strong advice to avoid non-essential travel at this particular time. That it does represent a risk, and perhaps even an unacceptable risk. And I also want to reiterate the importance of for those who have chosen to travel, and we know many Canadians have, that when they return, they have both a legal and a moral obligation to comply with all of the requirements of public health quarantine in order to protect their families, their friends, and their communities.
Thank you. We'll do one last question in the room, and then we'll go to the phones.
Minister Blair, it's Man Hamidi for the Canadian Press. These new restrictions are going to apply for on-air travel mainly, but how or will these new requirements apply for people arriving at land borders so these ports of entry don't be loopholes?
Yeah, thank you very much, Mano. And it's an excellent question. I think that right now the greatest concern that we have heard among Canadians is the impact of international travel at our airports. And so, as you have already heard, the Minister of Transport is moving quickly, utilizing his authority in order to put measures in place to require pre-testing, pre-boarding testing for people who travel by air internationally into Canada. We are working with our provincial and health authorities in a number of jurisdictions, looking at how we can supplement our strong border measures with additional testing regimes at land points of entry. There are issues of some complexity and that we're working through, but I want to assure you and all Canadians that we look at all movement of people across our borders as something that needs to be very carefully and strictly managed. The measures that we have put in place at our land borders have proven to be effective, but we are always looking at opportunities to supplement that and to improve upon that. And so that work is well underway, and there are discussions taking. But the very first place that we'll be able to implement a testing regime prior to arrival at our border is through pre-border through boarding testing that we propose today.
Okay, thank you. As a follow-up, I want to ask you, were the Liberal caucus members told not to travel abroad during the vacation to not set a bad example for other Canadians?
Well, I can tell you that I think the government's position has been very clear, and you know, the Prime Minister in his statements, all of my ministerial colleagues and I, our officials in public health, have all been very clear in discouraging Canadians from non-essential travel, particularly international travel, and we've seen the impact that the restrictions that have recently been put in place as a result of the the UK COVID variant, have been impactful on Canadians who had traveled outside of the country. And so our advice has been clear and consistent for a considerable period of time, encouraging people not to engage in non-essential travel. And the advice, I think, that has been unequivocal. People right now is not the time to be traveling. Now is the time to limit your contact, and in everyone's interest to take the steps necessary to help us get through the very challenging period that we're in right now. There is a light at the end of the tunnel. And we're very encouraged by the excellent work that's being done by Mr. General Fortin, by public health in making a vaccine available across this country. But until we have had widespread administration of that vaccine, we all have to continue to take the measures that are necessary to keep ourselves safe and our communities safe. And so we'll continue to encourage everyone to do that.
Thank you. We'll take two final questions on the phone. Operator?
Thank you. La prochaine question est de Guillaume Saint-Pierre.
Next question, Guillaume Saint-Pierre, Journal de Montréal. Question. Hi, a question about mandatory test results in airports for those returning to Canada. We haven't heard a lot of details. Can you give me a general idea of when this would come into force? The interpreter signals that it is a bit difficult to hear the question. Minister LeBlanc, I will answer the question, and perhaps Dr. New can answer as well. As my colleagues have announced, Minister Garneau, in the upcoming days, perhaps as soon as tomorrow, will be able to announce the details of the implementation of this measure. So it will be a requirement that all arriving airline passengers before boarding provide proof of a negative COVID-19 test performed within 72 hours before arrival or before boarding. This will be in addition to 14-day quarantine measures. As for testing upon arrival in Canadian airports, we are testing out some things. For example, in Montreal, we will have more information in the next few days. The bottom line is that 14-day quarantine is still absolutely mandatory. As Dr. New said, we have had measures in place since March to limit the spread of COVID-19. The most effective measure is quarantine. As Minister Blair explained, upon arrival to Canadian airports, as of last night, there is enhanced screening. Further questions are asked of incoming travelers. There will also be enhanced monitoring of those in quarantine to ensure that they are following the rules. Dr. New speaking. We are currently running a pilot project with the Government of Alberta. The data we are collecting, evidence-based data, of course, is rather interesting thus far. Approximately 1% of incoming travelers arriving at the Alberta airport test positive for COVID-19. So for each plane with 100 passengers on board, about one has COVID-19. That is an interesting finding. Now, if you have 100 travelers arriving in Canada, say, many of them would be identified at the borders. 68 would be identified at the borders. 32%, though, so 32 people, they are not found to have COVID-19, so they enter the country and then find out later that they have COVID-19. Even if we were to test at airports, though, there can be false negatives. So rapid testing in airports or any testing in airports upon arrival would not replace quarantine. Follow-up question, Dr. New. The requirement to show proof of a negative test result, the test could be done when the traveler is asymptomatic. Do you think that proof of a negative test result or having a negative test result will give people a false sense of security? Answer, Dr. New. Well, yes, that could be an undesirable consequence that we must take into account. Mandatory quarantine under the Quarantine Act must continue to be respected. Sometimes, though, someone might get a negative test result and think, oh, well, I don't need to quarantine then. Well, that's false, because someone can catch COVID-19 shortly before getting the test with the negative results, so the test wouldn't pick up the disease. To answer your question, yes, we must absolutely take that into account. I have discussed this with the province and provincial and territorial top doctors. We all agree that quarantine is the key, most effective measure. These other measures are complementary and supplementary.
La dernière question est de Sarah.
Last question, Sarah Exenos, Radio-Canada. Hello. A question about Ontario and British Columbia and setting vaccines aside for second doses. In Quebec, the approach is different. They will be setting aside second doses. Will the federal government be preparing guidelines for this? Answer, Dominique Leblanc. I'll answer first. Major General Fortin can answer after. As we've always said, the federal government's role is to acquire the vaccines and order them. Canada has the highest number of secured vaccine doses per capita of any country in the world. We have also succeeded in securing vaccine doses earlier than expected and in significant quantities. Now, currently, provinces either have received the vaccines or have already received them and begun sending them to vaccine distribution sites. Provinces have the responsibility of vaccinating their own populations and as soon as possible. As for securing further doses and shipments of Pfizer, BioNTech, and Moderna, Major General Fortin might like to say a few words to reassure Canadians. Major General Fortin. Thank you, Minister. I would like to repeat that vaccine producers do recommend that we keep a second dose. They, in fact, recommended that a few weeks ago when our January shipments were not 100% confirmed. Now, things are confirmed. We will be receiving our shipments. Now, provinces and territories do have to manage possible risks When it comes to our level of confidence in shipments, well, we have a lot of remote regions. There could be issues with winter weather and other logistical challenges. Provinces and territories will have to deal with these possible issues, like weather issues. A given province or territory might decide to vaccinate a higher number of people now and then use a future shipment as second doses for those same people. We respect provincial and territorial responsibilities, and that is a provincial and territorial responsibility.
Oui, merci.
Follow-up question. This question is for Minister Leblanc. These measures for pre-boarding, why weren't they implemented sooner? 3,000 Quebecers are returning from travels abroad today. Answer, Minister Leblanc. As we've explained, all incoming travelers, be they coming from the United States or elsewhere, the United Kingdom, regardless, all must complete a 14-day quarantine. As of now, there will be increased presence of border officers and other officers who will require detailed information about the quarantine plans of travelers. If border agents feel that quarantine plans are inadequate, then travelers will be sent to a site chosen by the federal government for quarantine. A quarantine which will be supervised by federal authorities. All those returning to Canada or arriving in Canada will absolutely have to quarantine. Quarantine is, according to science, according to data, the best possible way to protect against spreading COVID-19. And in fact, law enforcement will be doing compliance monitoring. They will be visiting those quarantining to ensure that they are following the rules. If people are not following the rules, they could face hefty fines or up to 6 months in prison of jail time. As for the UK variant, as Dr. New explained, quarantine is to thank for the fact that the UK variant has not spread in Canada. In the upcoming days, we will be announcing further measures. Most Canadians follow public health guidance. An important message that we are reiterating today strongly is do not travel if it is not essential. We've been saying this for a long time, and we repeat it today.
Thank you. That concludes today's news conference.
And you have been listening to federal officials give us an update on COVID-19 and lots of questions around international travel. The federal government announcing that in the coming days, there will be a requirement for those Canadians who are traveling outside of the country. When they come back to Canada, they will have had to take a test wherever you are 3 days before arriving back in Canada, and that you need a negative COVID-19 test 3 days before, and you will continue to have to quarantine for 14 days. They are also saying there are going to be more officers, more agents at airports, and who will be questioning quarantine plans, and if there are quarantine plans are not considered adequate, that you'll have to go to a site where you are able to quarantine. But the federal government, the federal officials there are strongly discouraging international, non-discretionary, non-essential international travel at this time, that now is not the time to go. Dr. New saying he's deeply concerned that many Canadians are traveling, saying stay home. There was a specific question about the Ontario Finance Minister, Rod Phillips, who we've learned has been on a Caribbean island for a couple of weeks or so. We heard Minister Blair say, just repeating that it's important for all Canadians to avoid non-essential travel, and there is a legal and moral obligation that you quarantine for 14 days upon return. There were also some questions about vaccines, that more vaccines are arriving, and interesting questions to the Major General Fortin about the Pfizer-BioNTech vaccine, how some provinces are stockpiling that second dose while others are choosing to inject, feeling confident that the next doses will be arriving in that 3-week period. That is up to the provinces. That is a discretionary decision the provinces can make, but that weather and other logistical issues can interfere in all of that. And we did learn that there are more than 3,000 Canadians now being treated in hospital. 720 Canadians are in critical care. We're going to Toronto now. Ontario health officials are taking questions after providing more details on the province's vaccine rollout. Let's listen.
In the populations to be vaccinated. I think at that point, Dr. Yaffe, I don't know if you wanted to add anything at this point or if we'll open for questions.
No, let's just open for questions.
Perfect. So we'll take questions. Unless, Dr. Smith, you wanted to add anything else after that?
No, I think that's great. Thank you.
Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
And a reminder to press *1 if you do have a question. And your first question will be from Christina Tenelia at CP24.
Hi, Doctor. Thank you so much for taking my question today. Dr. Smith, you talked about priority for the vaccine going to the most vulnerable groups. Dr. Heyer, you noted a list and a matrix. But you also noted in the framework for distribution that the priority should be given to those who experience or are likely to experience greater burdens due to COVID-19 in society. The framework document you have shared notes the Ontario Human Rights Commission's policy, and it also notes groups that include women and children facing domestic violence or abuse, people with disabilities, the LGBTQ community, workers in precarious employment, prisoners. But those groups, people in those groups, are nowhere listed formally in the first two phases of the vaccine rollout. So where do they fit in? And how does that fall into the equitable distribution of the vaccine?
Max, do you want to start with that, Dr. Smith?
No, I'd be happy to. So I think you're pointing to something really important that we wanted to highlight in the ethical framework itself, which is to say that we want to protect those populations who are most at risk, but not just due to biological factors, but also due to social factors, to geographical factors, and occupational factors. And so we wanted to build in the thinking that we can think about those that are at risk for other reasons other than just being high risk biologically. So I think, and as well as human rights concerns and other considerations that you've raised, these are all the